today I'll be showing you how to set up a non-invasive ventilator or BiPAP or NIV. So to get it all started, you want to go ahead and look at the patient's chart and see any indications for this. So it would be acute or chronic respiratory distress if the patient has CHF, or some complications would be tissue necrosis. So if the mask that they have to put on could cause some breakdown around the skin, around the nose mainly, and it could cause barotrauma. Some contraindications would be if the patient is apneic, so if they're not breathing, you wouldn't want to put this on the patient. If they're lethargic, if they have a pneumothorax, you wouldn't want to put this on the patient either. So a couple things that are advantages over doing invasive ventilation or intubation. You would just it's just because you don't have to sedate your patient, and it is non-invasive, so it's a little bit better for them. And with this BiPAP machine, it's the trigger and cycling. So the trigger is that it's spontaneous breathing, so the patient is spontaneously breathing, so they could trigger the breath in. And the cycling, that it's time, so if the patient isn't taking a breath fast enough, the machine will trigger a breath for them. So then you would just want to gather your equipment. You would always want to wear gloves before you're setting up the machine, and you would want to check the chart for any significant findings. So if they were on BiPAP before or previous, and then if they have a specific size mask, it would help you kind of decipher what size mask you want to bring into the room this time. If the doctor has set any prescribed settings, you want to check that in the patient's chart as well. So when you're setting it up, before you go into the patient's room, go ahead and put on some gloves. And then this is your machine. You want to get the machine. You have an oxygen source plus a plug. Then you would get your circuit plus your pressure line that normally comes attached with the circuit. And then you would get a filter. So then you would just attach the filter on, and then you attach the pressure line to the smaller. And this circuit comes with the expiration port as well. And then you would go ahead and hook up the plug to a plug that has a backup generator, which is normally the red plugs. Just go ahead and plug that in, and then you would plug it into the oxygen source. On your machine, and you would just have to do the systems check to ensure that the machine is working properly. So you would just go ahead and go to menu, and then go to mask port, and then you would just check the mask that you would choose. So this is a Respironics 1, so you would just make sure it's clicked, press accept. And this exhalation port comes with the circuit, and it's not any of the other ones. There could be different ones, but this one would just be other still. And you would just wait to do the test. So it says patient disconnect, you would just occlude, and then you can go ahead and start the test to make sure that there's no leaks. So it says the test is passed, so you can go ahead and start ventilation. So to start off this patient, if they don't have any doctor's orders, you can just go ahead and start them at 10 to 5, which is just kind of the baseline of what you would start a patient on to see it, and then you can adjust according to the patient. So you go ahead and just lower your IPAP to 10, and you can lower your EPAP to 5. And what IPAP is the inspiratory positive airway pressure, and that is helping with ventilation. So if a patient were to have high CO2, so if they're retaining a lot of CO2, you want to increase that by 2 to 5 just to help the patient have inspiration so they can blow out the CO2. And then EPAP, for a normal patient, normal healthy patient, we normally have an EPAP or CPAP of 5 in our body, and that just help opening or split the alveoli open. And if you were to have an oxygenation problem, so if they have low levels of oxygen, you would want to go ahead and increase the EPAP. And then so you would just want to go ahead and set your settings now. So respiratory rate, a normal respiratory rate is 12 to 20. So it just depends on what the patient is breathing now. So we can go ahead and leave it at 12. And then the oxygen level, if the patient were to be on room air, you can just leave it at 21% because that's how much oxygen is in the air. If they are on a different oxygen device, you would just adjust it accordingly. You can leave the eye time at 1 and the rise at 3 is fine. So then after you have your machine ready, and you would go ahead and set the alarms according to what the patient is breathing. So you wouldn't set it before, but a high rate, you would, right at the very top is what the patient is doing, but mine is not connected to your patient, but you would just adjust it to be 5 above and below their rate that they're breathing. So high being 5 above the 12, and low being 5 below the 12. And then high and low tidal volume, so whatever their tidal volume is, you want to go about 300 above and 300 below. And then for the HIP and LIP, you would do it based off their PIP. So you would do the same thing, 5 above the PIP and 5 below the PIP. And then you can leave the low tidal volume or the minute ventilation and the LIPT at 5. So then after that, you would just go into the patient's room, and that will be a different